Over the last 2 years, Cape Town has had a number of serious flood with 50-year flood levels that were breached. Palesa Base conducted research at an informal settlement in Makaza, which forms part of Khayelitsha. Interviewing a number of women over a period of time, she wanted to gauge how severe the impact of flooding is. Growing up in townships in Cape Town herself, Base found that floods are more than just physical and temporary events.
It means a halt to education, it means a halt to people's livelihoods, it means a halt to people's health. So I was very interested in exploring that further, and I'm actually exploring some of that work even right now here at ACDI, working with the City of Cape Town, exploring more at sanitation and also bringing a climate and gender intersection, because right now it's actually very much coming on the rise, trying to look at research that is based on climate change but also taking a gender perspective within it.
Floods affect everyone in informal settlements across the country. Through her study, however, Bess found that women who live in these communities often have small, informal businesses at their homes. Many are also sole breadwinners, providing for a number of people. Floods impact their ability to secure income for days on end, and they struggle to make it through the impact. Another major concern is around women's health. A great challenge is the ability to uphold feminine hygiene, especially made difficult during menstrual cycles.
A lot of these informal settlements have communal, shared informal facilities for sanitation, and lots of them are very inadequate. Sometimes they're not functioning, they're broken, because they're not well maintained. With this being said then, when flood waters flood the surrounding areas, the homes, these toilets are also very much vulnerable to being flooded. So then it makes it very difficult for these women to use these communal facilities. A lot of them actually mention using makeshift facilities and open defecation, which actually increases the spread of diseases and infections.
Among her recommendations, there should be greater focus on the risks associated with climate change, such as flooding, which will become more severe in future.
Building resilience, investing in property and infrastructure that is going to be resilient, and this includes better housing, improved drainage systems. All of that are important things that would add to coping. But I think it's also very important to realize that there is a willingness here. It's not like these women are just sitting around and that they're victims. There is a willingness to try and do something, but it's just that they need a little bit of help. They need the push, they need the support, and that goes to institutional support as well.
The researcher says policies and plans are made, often without engaging the women whose lives it will impact.
What's at the crux of actually dealing with this is to actually start developing strategies and policies and putting policies in place that are going to help and reduce these disaster risk impacts, and to adopt community resilience impacts and policies to help these women deal better with these flood risks, because they're not going to stop. Climate change is happening. Floods are going to continue to happen. And unfortunately, the reality, the access and the privilege to say, oh no, they can relocate to somewhere else is not there. It doesn't exist, right? So I think it's time that we put in place systems and policies that actually do accommodate the realities of these people, and to actually, work towards finding adaptive capacity.
Bess's work forms part of a broader and ongoing set of research studies into understanding the impact and effect of climate change. Palesa Base, SABC News, Cape Town.